Okay, hi and assalamualaikum to each and every one of you. First of all, I want to thank you all for gathering here to hear my speech. My name is Muhammad Akifai bin Zahir and I will share with you guys about dwarfism. Did you guys well know about this dwarfism? If not, don't worry. Come and join me. So, in this sharing, I will talk about what is dwarfism, the types, the cause, and the treatment of dwarfism. So, what is dwarfism? Dwarfism is a medical or genetic condition that causes someone to be considerably shorter than average man or woman. The average height of an adult with dwarfism is 4 feet, but dwarfism could apply to an adult who is 4 feet 10 or shorter. There are also other terms to dwarfism, which is short stature, little people, and little person. It's one of the largest advocacy group for people with dwarfism is the Little People of America, LPA. For your information, the word midget is not an acceptable label, so be mindful of your words to label a person with dwarfism, and also be sensitive to the challenges or prejudice they may face in everyday life. If we're getting to know more about this dwarfism, it would result in the best outcome for us. So, without further ado, let's move on to the important part of dwarfism, which is the types, the causes, and treatment of dwarfism. Let's go. Though there are many different causes of dwarfism, but there are two main types of the condition, which is proportionate and disproportionate. Proportionate dwarfism is caused by a medical condition you have at birth or that develop in childhood that hinders growth and development. When the head, trunk, and limbs are all proportionate to each other, but much smaller than those of an average sized person. This type of dwarfism is often the result of a hormone deficiency. It can often be treated with hormone injections while a child is still growing. As a result, someone born with proportionate dwarfism may be able to reach an average height or get close to it. For disproportionate dwarfism, this is the most common kind of dwarfism. Disproportionate dwarfism usually doesn't affect intellectual development unless a child has other rare conditions, including hydrocephalus or excess fluid around the brain. As the name suggests, it's characterized by having body parts that are disproportionate to each other. For example, a genetic condition called achondroplasia results in arms and legs that are significantly shorter than those of a person of average size. But the trunk is like that of someone unaffected by dwarfism. In some cases, the head of a person with disproportionate dwarfism may be slightly larger than that of a person without dwarfism. So, now that you know something about the type of dwarfism, let's take a look at the causes of dwarfism. Researchers believe there are more than 300 conditions that cause dwarfism. Most causes are genetic. The most common causes includes achondroplasia, hypothyroidism, Turner syndrome, intrauterine growth retardation, and growth hormone deficiency. So let's go to the first causes of dwarfism, which is achondroplasia. Achondroplasia is a genetic condition. 4 out of 5 people who have it also have two parents who are average size If you have achondroplasia, you have one mutated gene associated with the condition and one unaffected version of that gene. This is the most common cause of dwarfism. The second cause is hypothyroidism. Hypothyroidism is an underactive thyroid, especially if it develops at a young age, can lead to many health problems, including limited growth. Other complications include low energy, cognitive problems, and puffy facial features. A newborn's thyroid health should be checked as a matter of routine screenings. If your baby didn't have their thyroid checked, discuss it with your pediatrician. So the third cause is Turner syndrome. This genetic condition only affects females. It caused by a missing or partial X chromosome. Girls with Turner syndrome only inherit one fully functioning X chromosome from their parents instead of one from each parent. So next is intrauterine growth retardation. This condition develops while the baby is still in the mother's womb. The pregnancy may go to full terms, but the baby is usually much smaller than average. The result is typical proportional dwarfism. And last, we have growth hormone deficiency. The reason for growth hormone deficiency are not always clear. Sometimes it's tied to a genetic mutation. In many cases, the reason for growth hormone deficiency are never diagnosed. However, as we know about the causes, we also need to know about the treatment of dwarfism. So, early diagnosis and treatment can help prevent or lessen some of the problems associated with dwarfism. People with dwarfism related to growth hormone deficiency can be treated with growth hormone. For children 5 years of age and older with achondroplasia who still have the potential for growth, the FDA has approved vosoritide to help stimulate bone growth. In many cases, people with dwarfism have orthopedic or medical complications. Treatment of those can include hormone therapy, surgical option, and physical therapy and orthopedic. Hormone therapy is for people with growth hormone deficiency. Injection of synthetic human growth hormone may be helpful. Children receiving this treatment don't always reach an average height, but they can get close. The treatment includes daily injection when a child is young, though injection may continue into a person's 20s. This may be done if they are concerned about full adult maturation and sufficient muscle and fat. Girls with Turner syndrome need estrogen therapy and other hormones to help trigger puberty and appropriate female development. Estrogen therapy may be necessary until a woman reaches the age of menopause. Surgical option is for others with dwarfism. Surgical treatments may be necessary and helpful to living a longer and healthier life. Surgical treatment include those that are help correct the direction of bone growth, stabilize the spine, increase the channel in vertebra surrounding the spinal cord to relieve pressure on the spinal cord. Another surgical procedure for people with excess fluid around the brain is to place a tube that called shunt in the brain. This can relieve some of that fluid and reduce the pressure on the brain. For physical therapy and orthopedic, non-invasive solution to some complication of dwarfism. So physical therapy is often prescribed after limbs or back surgery to help you regain and improve your range of motion and strength. Physical therapy may also be advised if dwarfism is affecting the way you walk or is causing you pain that doesn't require surgery. Orthopedic are custom-made devices that are fit into your shoes to help improve your foot health and function. If dwarfism affecting your balance, how you wanna walk, or other aspect of foot to functioning right. So the conclusion of the topic is dwarfism occurs when a person has short stature. Most forms of dwarfism are genetic or inherited at birth. More than 300 genetic conditions can cause dwarfism. It can also be caused by a medical or hormonal condition. People with dwarfism often have a long and fulfilling life. The condition doesn't affect the ability for them to go to school or work or have a family or enjoy any of the other things life can offer. So, remember, dwarfism is not a disease, so there is no cure for this condition. So, my recommendation is dwarfism can lead to potentially serious medical complications. It's important to keep up with annual physical and visit to specialists as needed. Being proactive about your health and responding quickly to changes in your symptoms is very crucial. And also, the physicians working in children's healthcare need alertness to detect errant growth rates and provide patient-centered interventions. I think that's all from me. There's nothing else I want to say, but thank you so much to all of you. Thank you.